Support for Conversations Live comes from the members of WPSU and from the Penn State Alumni Association, informing, involving, and inspiring Penn State alumni and friends worldwide through programs, events, and communications.
Good evening and welcome to Conversations Live, Community Water Fluoridation. I'm Patty Satalia. The Centers for Disease Control and Prevention calls community water fluoridation one of the great public health achievements of the 20th century. But critics say fluoridated water is not as safe and not as effective as we've been led to believe. They argue for a consumer's right to choose. Today, more than 60 years after the first public water system was fluoridated in Grand Rapids, Michigan, the debate rages on. Why is this long-standing practice still so controversial? And what are the benefits and risks of fluoridating drinking water? Tonight, we'll talk about that, and you can join the conversation. Our toll-free number is 1-800-543-8242, and our email address is connect@wpsu.org. If you'd like to join us on Twitter, you can tweet a question to @WPSU. Now let me introduce tonight's guest. Michael Conant is a Philadelphia attorney and the Special Projects Director for the Fluoride Action Network, an international coalition aimed at ending water fluoridation and alerting people to what it says are fluoride's environmental and health risks. Mahal Meyer is editor-in-chief of Chemical Heritage magazine and manager of public history initiatives at the Chemical Heritage Foundation, a nonprofit based in Philadelphia that preserves the history and heritage of chemistry, chemical engineering, and related sciences and technologies. Dr. Craig Collison is a pediatric physician with Mount Nittany Physician Group in Boalsburg and Bellefonte. He's a director and vice chair for the Mount Nittany Physician Group Board and chairs the Patient Quality Care Committee. Dr. Collison is also an assistant clinical professor of pediatrics at Penn State. Thank you all so much for joining us.
Thank you.
Thank you. As I mentioned at the top of the program, Mahal, the first public water system began fluoridation in 1945 in Grand Rapids, Michigan. The move was controversial then. It's still controversial now. Give us a brief history of how and why this practice started.
Well, a good place to start is probably the very beginning of the 20th century with a newly minted dentist called Fred Mackay. And his first job, basically, he graduated from the University of Pennsylvania, was out in Colorado in a town. And he noticed something that he had never seen before as a dentist, that many of the children in this town had mottled teeth, brown stains on their teeth, ugly brown stains. And he got curious about this. As a dentist, he really wanted to figure out a way of stopping or somehow reversing this brown stain. But he started researching different areas. He found a lot of other towns in Colorado that also had the same stain. It became called Colorado stain. And he also realized that very curiously, one town may have this problem, but another town very close by would not have this problem. And eventually he realized that it came down to the water. One town that had it had a different water supply to a nearby town that did not have the Colorado stain. So he realized eventually that it came down to the water, but then the question, what was in the water? And he did some studies. Other people also examined the water, but they were just looking at common things that you would find in water. They didn't find anything unusual. And it was really only until 1931 when a town called Bauxite, which was actually an Alcoa, an aluminium town, were also having the same problem. All the kids there basically had these brown mottled teeth as well, that the chief chemist of Alcoa got interested. And he did some pretty serious chemistry and discovered that it was fluoride. There was fluoride in the water.
And what they were exhibiting was fluorosis, dental fluorosis.
Then after that it became called dental fluorosis. Now around this time, 1931, someone working for the Public Health Service, his name was Trendley Dean, got also interested in this problem. He was actually appointed to look into it, again with the idea of trying to prevent it. But Mackay had noticed as early as the late 1920s that children who were afflicted with this dental fluorosis also suffered from less tooth decay. And Dean pretty soon got more interested in the fact that this fluoride seemed to prevent tooth decay than in actually trying to stop the fluorosis. So really in the mid to late 1930s, you start seeing more and more interest in preventing tooth decay. But this is still pretty much within the scientific community. I think sometime in the 1930s, a biochemist, actually from Pittsburgh, I think, is considered to be the first person to say perhaps we should fluoridate water, and this way we can prevent dental decay, because dental decay was a real issue. It wasn't unusual at that time. By the time people reached old age, they had lost all their teeth. So if you can prevent dental decay, obviously people's mouths would be much healthier, they would keep their teeth. And so in 1942, basically the whole thing goes public. There's a big article in a very popular magazine called Collier's that is basically about the town without a toothache. It was a town in Texas.
Despite the fact that there were some mottled teeth
Oh
in,
yes,
in
this town had
as well.
mottled teeth. The magazine article did not actually mention the mottled teeth. It was only talking about the lack of dental decay in this town. So by the 1940s, the early 1940s, this is becoming public knowledge, and pressure builds up to have a trial. And there was actually a comparison trial done in Texas, but the Grand Rapids and its control city, Muskegon, were the first time where fluoride was going to be deliberately added to water to see what the effects.
And in Grand Rapids, Michigan, there was a huge debate. Some who fought to prevent it.
Not so much at the beginning. The city as a whole was pretty much for it. I mean, it was sold in a very positive way. At the time, there weren't the same kind of issues with fluoride that we have today. I mean, fluoride was used as a rat poison and an insecticide, and very quickly that became part of the story about fluoride being a negative thing. But there wasn't, at the very beginning, there wasn't as much negative press as you might expect today. And in fact, the trial was supposed to run for about 15 years. It basically ended after 6 years because the control city had seen the effects in Grand Rapids, although there was a very big reduction. So basically they said, oh, we're not going to do this anymore, we're going to fluoridate our own water. So in a sense, the control city, by fluoridating its own water, brought the trial to an end after only 6 years.
And today, according to the Centers for Disease Control, something in the neighborhood of 62% of U.S. households drink fluoridated water. Mm-hmm. So I ask of you, Dr. Collison, do you believe today, more than 60 years later, that water fluoridation is still good public policy?
I believe overall it's very good policy because it has done such an incredible job at saving the teeth of children. We see it here locally because we have some that get fluoride in their water, some that don't. So we constantly are having to figure out where kids are, and the kids that fall through the cracks and don't get fluoride, it's very obvious they have significant tooth decay at much higher levels than the kids that do have the fluoride in their water. So I think overall it's been a very positive thing for the teeth for kids locally, and it sounds like across the country.
We're going to talk more about that, but I go to you, Michael Conant, because you have maintained that water fluoridation is not good public policy. Why should we believe what you're saying when all of the major health institutions, health agencies in this country say that it is?
Well, I think in America, when we talk about fluoridation, we often kind of have a pretty narrow context. We kind of just look at America. And if you look at it a little bit of a broader perspective, and you look at most of the Western world, most advanced nations, they don't fluoridate their water. They considered it, like in Sweden in the 1970s, there was a robust debate, but they decided not to fluoridate their water. So in Western Europe, for example, 97% of Western Europe does not fluoridate their water. And what's also telling about that is that they've seen the same decline in tooth decay in all of these Western countries that in America is attributed to water fluoridation. So, as just as an initial matter, most Western countries do not fluoridate the water. And in fact, more people drink fluoridated water in the United States alone than the rest of the world combined.
There are some who would say that Americans have better teeth than Europeans.
Well, actually, that's not borne out by World Health Organization data. World Health Organization compiles extensive tooth decay data by country, and if you look at that data, there's no difference. In fact, the United States ranks, I think, 13th or 14th in terms of overall tooth health, oral health. Also, in terms of policy, one of the, I think, basic questions about fluoridation, which has troubled a lot of people, and is one of the reasons why Europe has rejected it, is because fluoride is the only chemical that we add to water that doesn't actually treat the water. It's designed to treat you, the consumer. And by the definition of what a medication is, fluoridation squarely fits the definition of a medication because it's not a nutrient. We don't need fluoride. It's not essential. But some people, some doctors and dentists believe it could help us in preventing a disease, tooth decay. But with all other medications, no matter how much the doctor might like that, it's the patient's right, and water fluoridation takes that right away from each person.
That's an excellent point, Dr. Collison. Informed consent. I mean, doctors believe that they tell their patients what their options are, and then the patient decides. There are some who would say, water fluoridation today, why not add diet medications to the water? Or vitamin D. Lots of Americans are deficient in vitamin D.
Sure. And those are good points. Fluoride in the water, as long as patients are aware, they do have a choice whether or not they consume their water at home. So I do think they do have some choice by buying bottled water, by going outside, if they don't feel that is appropriate for their children's health.
And the reality is that half of Americans do buy bottled water, 1/3 on a regular basis, which in a way says to me, are we pouring these public health dollars down the drain? How would you respond to that, Mahal?
Well, I don't actually see much of a distinction between chlorination and fluoridation. Both of them end up in your body in that sense. I mean, chlorine stays in the water, you're ingesting it in very similar ways.
But chlorine is done for a completely different reason, to kill bacteria in the water. So it's more done for a safety reason rather than to promote health.
Well, in terms of the individual choice thing, I think you're really balancing public health against individual choice, and where people draw the line is going to be different. I tend to be more on the public health side personally, because it is a community. I mean, it's both community and it's both individual, because if you're talking about the children of a community, should choices be made for them on an individual basis, or should that be a community-based choice?
Well, I'm going to take our next phone call in a moment, but I guess the question comes down to, you sent me some information from the American Academy of Pediatrics. It states, the CDC states, the American Dental Association states, that the predominant effect of fluoride is topical, not systemic. In other words, we can get the benefits of fluoride from toothpaste, and fluoride, of course, is readily available in toothpaste. I'll ask you to weigh in on that, Michael Conant.
I think that's a really important point, and it's something that we didn't know when we started fluoridation back in the 1940s. The belief back then was you needed to swallow this. And that's why we added it to water and pills, because you swallow those things. So today, we now know that the main benefit is just by applying it directly to the teeth. So, but the risks of fluoride, which I'm sure we'll talk about, come from ingesting it. So to me, it's a kind of common sense issue. We now have over 95% of our toothpastes contain fluoride. So it's very easy to get fluoride, and you can brush it on your teeth and you spit it out. With fluoridation, by adding it to the water, you're now consuming it, and you're taking on an unnecessary risk. And not only you're also forcing people to take that risk when they might not want to take it. And in terms of getting bottled water, one of the problems with this issue is a lot of people can't afford to always buy bottled water, and they can't afford.
Which takes away the choice that you were talking about a moment ago. Yeah. And not only bottled water, lots of Americans, I think it's somewhere in the neighborhood of 30%, have home filtration. But of course, to remove fluoride and other things, you need reverse osmosis, which is much more expensive. So let's take our first phone call. Then I'm going to come back and talk about dosage and some of the health risks that are apparently part of this. Matt's calling us from Altoona. Go ahead, please, Matt. We got a phone ringing, so we'll go to our next call if Matt's not there for us. Martha from State College, are you on the line?
Yes, I am.
Hi, Martha. What's your question or comment?
Well, my comment is I've been a dental hygienist for over 40 years, and I have seen the benefits of water fluoridation in the generations. Let's put it that way.
But let me ask you this. How do you know it's water fluoridation rather than the fluoride in the toothpaste or the fluoride applications that you might apply in the dental practice you work with?
Well, because they didn't have as much of that in the early 70s as they do now. So we saw lots of children with missing and decayed teeth and a lot more children needing fillings, interproximal decay, and parents who had missing teeth and bridge work and dentures. So we started out with people needing a lot of dental work.
Okay.
I think the thing that water fluoridation has done is it has reached a larger portion of the population at a reduced cost, because with the cost of dentistry escalating, fluoride only costs dollars instead of hundreds of dollars. So I think that the water fluoridation really has made the difference.
Thank you, Martha, for your phone call. Martha is seeing a difference where she is. And in fact, the Centers for Disease Control, Michael, says that for every dollar we invest in water fluoridation, we're saving $38 in dental costs. How do you respond to that?
Well, as a first point, I think with the CDC's cost effectiveness estimate, they admit that they don't include the costs of children treating dental fluorosis. And we now know that fluoridation causes dental fluorosis, which is a staining of the tooth enamel, can cause white stains, white streaks, white spots, and sometimes brown staining. And we know that children today are often embarrassed by these stains and will seek cosmetic treatment. So those are costs that children and parents are taking on, which the CDC doesn't even account for in their cost savings benefit analysis. The other thing is there's a reason why fluoridation is so cheap. And that is we use a very cheap industrial chemical that has it doesn't have many uses. It's called hydrofluorosilicic acid, and it comes from the wet scrubbing systems of the phosphate fertilizer industry. It's a very dirty industry, and this chemical is not, it's a hazardous waste if it wasn't used for fluoridation. It's not a high purity product.
And in fact, the CDC says there are reasons, Mahal, for not using pharmaceutical grade fluoride in water fluoridation. Can you respond to what Michael said?
Well, I actually see it as reuse, which I think is a good thing. In terms of versus a pharmaceutical grade, I think as long as it reaches certain purity standards, I mean, the fact that it comes from a particular industry rather than back in the old days it used to come as a byproduct from the aluminium industry and then it was sodium fluoride. I mean, to me, that is less relevant as long as there's not anything else apart from this chemical in what you're putting into the water. I mean, that may be an issue, I don't know, but the chemical itself, I don't think where it comes from is relevant.
And in fact, most of it comes from, it's produced in the fertilizer industry in Florida. Another section of it comes from Asia.
Yes, because the rock, oftentimes the rock that has the kind of fertilizer you want, phosphates I think in this case, is often also very high in fluoride.
Now, Michael brought something up that's interesting, Dr. Collison, and that is fluorosis. You talked about the fact that it was happening naturally, Mahal, back in the 1930s, and we were seeing these mottled teeth in children and adults in Colorado and elsewhere. According to the CDC and the American Academy of Pediatrics, today, 49% of 12 to 15-year-olds have some degree of fluorosis. Is that a concern to you?
It has not been a concern to us. There are some cosmetic when you have severe fluorosis and the brown staining. A little bit of white staining, in our estimation, has been better for the teeth than allowing them to decay and have cavities and caries.
The National Academy of Sciences says they urge that we change it from a cosmetic problem to a negative health consequence. And I think that's an interesting point, because so often it seems that by the time you can see something visually, For instance, by the time, to be perhaps too graphic, by the time you have blood in your stool, your problem is pretty big. By the time you have yellowing of the eyes or the skin, and you can visually see that there's something going on, you've got substantial liver damage. So I'm wondering, the fact that you can see this, isn't it possible that there's actually something more going on?
I suppose it's possible. Again, coming from a pediatric standpoint, we have not seen any systemic or significant issues with that. And with dental caries being such a huge problem with kids, it's felt that if erring on the side of having more fluoride rather than less fluoride has been the standard that the American Academy of Pediatrics has taken to this point. Long term, that's very interesting to see what kind of effects. Maybe this generation is going to have better teeth, but are there going to be any long-term effects in their 50s, 60s, 70s?
And in fact, I want to read one thing. I printed this. This is from the Public Health Service, Department of Health and Human Services, February 1991. I found this on the CDC's website. Further epidemiological studies are required to determine whether or not an association exists between various levels of fluoride in drinking water and bone fractures. And so there's part of me saying the fact that there's not evidence that it is causing problems isn't evidence that it's not.
That's correct. I don't think we really have a good understanding of that as shown by that study. What the long-term, we know the short-term benefits and the long-term benefits of having fluoride. We can see that the dental hygienist who called in is seeing how much better patients' teeth are as they come through their practice through the ages. So there's an obvious benefit. We haven't found the detriment. It's possible that there may be something there, and we don't know.
Okay, we'll take a call now from Kay, who's calling us from State College. Go ahead, please, Kay.
Yes, thank you. The last gentleman just spoke about, or someone there just spoke about bone fracture. We also have a lot of studies coming through from New Zealand, from Sweden, from places in Europe, as well as cities in the United States who have dropped the fluoride program. But we also have lowering of IQ, the lowering of the thyroid, and that's a major health problem today.
Lowering of thyroid function, you're saying?
Thyroid.
As a result of fluoride?
Yes, and there are many studies coming out now, and some of them are shorter term. Obviously, they've been doing it for the last 10, 15 years, specific kinds of cancer. I really appreciate the value of the healthy teeth, but I think today we have products like xylitol, which so far are proving to be extremely safe.
And xylitol
and I really wonder when all these other countries, many of our cities which have done away with it, have done massive studies about the value. And today, I agree with the person that said, we're not showing that we have any better teeth than they have in Europe today. I think we're learning how to take care of our teeth. We've had a massive education in that. So I definitely am not in favor of fluoride in the water, and I hope that we will get rid of it. Thank you.
All right, Kay, thank you for your call. Michael, your comment.
Yeah, 2 points about the thyroid effects and the IQ effects. About the thyroid, a really interesting part of fluoride's history that I think a lot of people don't appreciate is that fluoride was once prescribed by doctors in Europe and South America up through the 1950s to reduce thyroid function in people who had overactive thyroid glands. So they wanted to bring that thyroid function down. And the doses that were able to reduce thyroid function were about 2 to 5 milligrams of fluoride per day in a pill. Well, many Americans are now receiving that level of fluoride from their diet and from water, from toothpaste. So there is a question about whether fluoride could be contributing to hypothyroidism, underactive thyroid, which is a very common health problem, especially for middle-aged women. And the National Academy of Sciences in 2006 brought attention to this concern. And also, with respect to IQ, in July of 2012, scientists from Harvard University published a paper which reviewed over 27 studies, mostly from China, that have found that elevated levels of fluoride, so generally more fluoride than American children get, but not that much more, these studies overwhelmingly have found that this high fluoride exposure is associated with reduced IQ in children. And in the United States, one of the problems we have is we're not doing the necessary studies to find out what else fluoride could be doing to our health. And we have not had a single, not one study in the United States ever to look at fluoride's effect on IQ. And so it's very difficult, I think, in the United States right now to make any confident pronouncements of the program's safety.
Let me ask two things. Dr. Collison, are we seeing more thyroid issues? As a physician, are you seeing that?
Not in my population.
Well, you're working with pediatrics. We hope not in your
Yes,
population.
yes.
Wow, we'd be in enormous trouble.
Sure. So I'm not sure what to tell you in regards to if you're seeing increases in that, given the fact that this middle-aged population has had fluoride, a lot more fluoride exposure than the generation before them.
The dosage is an issue, and I'm going to take the next phone call in just a moment, so hang on, please, Glenn. But the dosage is an issue. If we are using fluoridated toothpaste, and I think most Americans are, fluoridated mouthwash, you can go to the dentist and get fluoridated gels, then any foods that you're eating that were produced, any processed foods that were produced using fluoride, the fluoride is in that food as well. It's in fruit drinks. It's used as a fumigant, an insecticide, a pesticide on fruits, so things like raisins and grapes have fluoride. How do you know what dose any individual is getting?
It's a huge challenge for us. I said we always have to figure out if there's fluoride in their water. Some of the local schools offer it there, so sometimes people are getting it through their school. What kind of water are they using, if they're making formula, or what kind of water do they drink at home. They may have it in their water supply, but they may not drink any of it. They may use bottled water that doesn't have it. So it's a real challenge for us to figure out what exactly they're getting. Young kids, we have the concern with eating toothpaste or not spitting out enough of their toothpaste.
And we know that children do that.
Sure.
In fact, the CDC recommends that until a child is 2, the parents shouldn't even use a fluoridated toothpaste. And I'm wondering if parents even know that.
We do talk about it, but again, everybody does not get the same amount of medical care, the same kind of attention to this as they should. And I think that goes somewhat to the public health with using it in the water in general, and how inner city populations were probably benefited more than local populations here because of the lack of exposure, the medical care. So the fluoride there makes more sense in some ways than it does in a community where you have good medical care and you're taking care of that.
There's even debate on that, but we'll be back
Sure.
to talk about that in just a moment. We now go, as I promised, to Glenn, who's calling us from, is it Rolette, Glenn?
Yes, it is.
All right. What's your question, please?
Well, I would just like to say I actually work for a water company, and it seems as though us as a society have to add chemicals to everything that we ingest, or, I mean, you take perfectly good water and start adding chemicals to it, and that's why people buy bottled water, because you've made our water so you can't even drink it anymore, all this chemical addition. And I don't think it's right.
Interesting. What Mahal, your reaction to someone from a water company?
I would just like to point out that not all bottled water is fluoride free. It depends
Correct.
where the water comes from. So some bottled water most definitely will have
And some
fluoride
bottled
in it.
water, it's actually labeled that they have added it. But the CDC, the American Academy of Pediatrics, says that you should assume that it has less than your fluoridated tap water.
Right. I'm not sure that that is always
Correct.
accurate. Again, it depends where the water comes from. Some
Absolutely.
areas just have naturally very high levels of fluoride.
But that's adding to this unknown.
It certainly is. I mean, I actually think that is the issue. All the sources of fluoride, because as you mentioned, fruit and vegetables we eat may well have been watered with water
Or
that contains
fumigated.
fluoride. Or fumigated. The milk that you drink, it may have been produced by cows that are drinking fluoridated waters themselves, you don't actually know. And I think, I mean, that's one of the reasons why there have been recommendations recently to drop the levels of fluoride in drinking water, because there are all these other sources. So it is something that is in the medical conversation, as far as I'm aware. So
that's right. It was reduced from 0.7 to, or from a maximum of, you give me the numbers.
The optimal range for the first 50 years, up until 2011, was 0.7 to 1.2 parts per million, and now they've dropped that down to 0.7
because of that
million.
high fluorosis rate.
Because of the high fluorosis rate.
Okay.
Although, just as a personal thing, I've only ever met one person in my life who has dental fluorosis that I could actually notice it. So in some ways, I wonder if the very, very, very mild fluorosis, that is the common kind of fluorosis, how noticeable is that actually? I don't really know.
Perhaps a dentist will call us who has seen this, because 49%, according to the American Academy of Pediatrics, that's an enormous, that's half the population.
I've seen a lot of fluorosis. I mean,
I've seen the pictures, and it can just look very benign, little little white chalky spots that don't look like much of anything. But I've seen really mottled
and even
images.
Recent studies have found that because the teeth are a very significant part of one's view of themselves, their self-appearance. And so even like what someone might call mild fluorosis, that white like snow capping of the front teeth, that can cause children a lot of embarrassment. And studies have found that over the past 20 years. And the CDC even calls mild fluorosis on the front teeth cosmetically objectionable, and they recognize that there are children now who are going to the dentist to get cosmetic procedures, which can be quite expensive. So for the children who have it, it can be more significant than we think.
And there are some who say teeth are the window to the bones. But before we talk more about that, I want to get Matt, who called us earlier, and somehow we didn't get him. Matt, from Altoona, you are on the air. Your question, please.
Well, it's not actually a question, it's a comment. Fluoride is poison. And it even says on toothpaste that you're not supposed to swallow it because it can cause health problems. It says if you swallow too much, you see a doctor right away. You know, and then they're going and putting fluoride in people's water and forcing it upon them, like, you have to consume it. No, it's just wrong. I mean, it causes corrosion in pipes. I can only imagine what it does to the human body. I mean, I don't have fluoride in our water in Altoona, and they're actually taking it out of the Tyrone area. They're taking it out of their water because they've done studies, and they're finding out it's not as good as they thought it was. And then you have preschools that are forcing it on, the kids whenever they're in there. They're saying, oh, yeah, you have to take this fluoride. And it's just wrong.
You're saying an oral fluoride, a supplement.
Yes, and it's not good. I mean, to keep forcing fluoride on these kids
Matt, all of the major health agencies say that it is good public policy. The Centers for Disease Control calls it one of the 10 great health achievements of the 20th century. Well, how do you reconcile... just finish your comment, if you would, and then I'm going to go to Mahal and have her weigh in.
Okay. Look at poor countries like Africa. You look at how good their teeth are. They don't have fluoride in their water, but they have healthier teeth than most of the people in the United States. It's not that you should have fluoride to make your teeth healthy. You just got to brush and take care of them.
Okay, thank you.
Fluoride, it does nothing for people.
Thank you very much, Matt, for your phone call.
Well, starting with the Africa thing first, I mean, sugar is the main driver of cavities.
I was thinking sugar.
There are actually archaeologists, believe it or not, who study teeth in ancient graveyards. And in Europe that they found that dental decay was actually pretty unusual until the Middle Ages. And what happens in the Middle Ages is sugar first becomes available. But it's luxury. It's very expensive. So people don't eat much of it, and you have to be wealthy, really, to afford it.
And explain, Mahal, the process, or maybe Michael, the process. Why does sugar contribute to tooth decay?
Well, there's bacteria in the mouth that basically eats the sugar and then excretes acid, and the acid starts to erode the teeth. But I think the sugar is an absolutely key factor here. But that's why I think the Europe comparison is very interesting with America, because as the dental hygienist who called earlier said, people in the United States had a lot of problems with their teeth in the 40s and 50s. We've seen a great reduction in cavities in the past 60 years. And it's tempting to want to say, well, that's because we added fluoride to water. But the same story is said over and over in all of these countries. So you go to Sweden and Netherlands and Germany and France and Italy and Denmark and Finland and Iceland, and you'll see the same, like, the children today would be like, well, our grandparents had really bad teeth. Or a dentist there will say, well, my patients 50 years ago had horrible teeth.
And
but
why?
today,
Was it dental hygiene?
There's a number of factors as to why oral health may have improved. One is increased attention to brushing teeth and going to the dentist more often. And if one, some people would say it's because fluoride toothpaste. All these countries have fluoride toothpaste. Europe uses fluoride toothpaste. So there's many factors that might explain why 30 or 40 years ago, someone might have had really bad teeth, and the kids today are having less tooth decay. And it's not just because of fluoride in water.
And the European, when Americans say that we have, let's say, more attractive teeth than Europeans, more Europeans smoke cigarettes. So I think there's more, perhaps, staining. May be an issue. We go to Dick, who is calling us from Johnstown. Go ahead, please, Dick.
Thank you. I have a question for the attorney and then a hypothetical question for the doctor. And my first question to the attorney is, have there been any court cases that would help folks that oppose fluoridation in drinking water? Well, and secondly, to the doctor, hypothetically, what if the ophthalmologist suddenly came up with a compound that would prevent glaucoma, and the cardiologist would come up with a new compound years in the future that would, not a statin, but similar to a statin, that the folks would be told this will prevent heart disease? Where would it stop? And I thank you very much.
Thank you, Dick.
Well, actually, there's a court case here in Pennsylvania, and by the Chief Justice of the Pennsylvania Supreme Court, Chief Justice Flaherty. When he was a trial judge back in the late 1970s, heard about, I think, a 2 or 3 week trial with all the experts flown in to talk about the risks and the benefits of fluoridation. And this judge concluded that fluoridation was a risky and dangerous procedure that was not worth the benefits. And basically, he came down very strongly after listening to the evidence that this was a dangerous practice. And the judge stayed, he remained involved and never changed his view on that front. And there have been other cases like that in the United States, one in Illinois and one in Texas. Unfortunately, in the United States, the biggest legal problem that we faced is that courts have accepted the view from health authorities that fluoridation is not a medication. In
fact, most people think it's an essential nutrient.
And that's the thing, that the courts have been prepared to accept this as, well, under the police power of the state, and that it's a kind of fortification. But if you look at the science, we know today that fluoride is not a nutrient. It's not like calcium. It's not like potassium. You don't need it. You don't need to ingest it. So it's fundamentally different. And it just fits the definition of a medication. And the FDA defines fluoride as a medicine when used to prevent disease, and that's exactly what we're doing with fluoridation.
And dental decay is considered one of the biggest health problems worldwide. Now,
Sure.
to answer the second part of the question,
Sure.
well, what if we were to add a statin to water, or
Sure.
to
Yeah, it's always a balance between a public health, looking at the financial implications of, heart disease versus the individual rights, and I feel like there's a lot of hypotheticals with that.
But we get back to that informed consent, really. We consent to everything else that we ingest.
Sure, and I think it's a valid point to say, is it worth the public health benefit that we have seen, which I do think is somewhat in part to the fluoride. There's other issues, obviously, that we've talked about, but certainly fluoridating the water has been of benefit to the children's teeth of this country. And I don't think that's up for debate. But there are other implications.
There
absolutely
are
are
other
other
ways.
ways. There are topical applications.
Where you have the benefits without the risks.
And could we figure out a way to do that without putting it in the water? And I think that's certainly a possibility. I think there are definitely benefits to kids to having fluoride applied to their teeth. And if we can figure out a way that every child in this country can have that done without putting it in the water, that certainly would be a reasonable thing to look at.
I'm going to take Sylvia's phone call in just a moment. But what's interesting to me, Mahal, is that we look at fluoride and we talk about it, those who promote it, the major health agencies that say this is good public policy, they talk about it as a natural element. I think it's the American Academy of Pediatrics that say it's the 13th most common element in the Earth's crust. Well, lead is a common element. So is arsenic.
Yes. Yeah, I completely agree with you. I think this whole natural versus human-made is, in some ways, very, very unhelpful. The fact, and also there was a previous caller who was calling fluoride a poison, and yes, it is a poison, but so is everything else. It really
the dose
comes
makes
to
the poison.
The dose, and actually, there is a 16th century physician who said exactly that. His full name is Theophrastus Bombastus von Owenheim. A wonderful name. His short name is Paracelsus.
Especially with your accent.
Yes, so his short name is Paracelsus. So that's been known for a long time. So there are a lot of poisons. Often what makes something a poison also will make it a very good medicine. So arsenic, that was the main environmental poison in the 19th century and the first recognized basically environmental health hazard.
Right, blood thinners are used as rat poisoning as well, but for some people they're can be very helpful.
You can say that for a lot of things. So I would say water can be a poison. You can actually kill yourself with water if you drink too much. It's incredibly hard to do, but it has happened. So again, the dosage, if you have too much fluoride, oh yes, it is a poison.
Michael, you have something to add?
That's completely correct. The dose is the poison, no matter what chemical you're talking about. The problem with fluoride is that the margin that we're looking at between what we're getting today and what can cause over-frank toxicity is very small. I mean, in 2006, the National Academy of Sciences concluded that the quote, safe level, which is 4 parts per million, which is only 4 times more than we purposely add to water, is not safe. That it will cause harm to some people. So we don't know. They have not yet set the new safe level.
And this new safe level has only been in effect for a year, 2 years at this point.
And that's the reduced optimal concentration. But so I think the big question today with fluoride is, what is the margin of safety, and how did? Because the problem we've had with fluoride for so long is we've treated everyone as if there's one fixed dose for everybody. You have 200 million people in the United States drinking fluoridated water, and the assumption is all of those people will respond.
The 2-year-old and
the 2-year-old, the 70-year-old, the person with chronic kidney disease, the person with thyroid disease, the person who's chronically undernourished. They're all going to respond the same way. You don't have to tailor the dose at all. You can they can drink as much as they want, they can get as much toothpaste as they want, no problem. And that's just not the way we deal with other toxic medical substances. You always want to be able to tailor the dose to the particular needs of the particular person. So I think that's why, and I'll close that here, Dr. Arvid Carlsson won the Nobel Prize for Medicine in 2000. Dr. Carlsson was a scientist who led the campaign to end fluoridation in Sweden. And Dr. Carlsson says fluoridation violates modern principles of pharmacology because you're treating everybody the same. And I think that's the problem with fluoridation.
200 community. I'm going to go to Sylvia because Sylvia has been patiently hanging on. Sylvia from Portage, what's your question or comments?
Hi, Patty. I'd like to thank you very much for bringing this most important issue to the public. I do have a PhD in the health field. I've been writing about fluoride and reading about fluoride for many years now. And I just wanted to ask our pediatrician about an American Dental Association announcement they made several years ago that parents should not use fluoridated water to prepare baby formula. And I was wondering why this information has not reached the public.
Excellent. That is embedded in the CDC's information that if you want to reduce the chances that your child, your infant, will end up with fluorosis, don't use tap water that's fluoridated. But my goodness, I raised 2 kids. I never saw anything like that.
I just recently saw that as I was preparing for this. So it's not been well publicized, that's for sure. I don't have a good answer why, but it hasn't been. Yeah.
All right. Jason, and what can we do? As a physician, as a pediatrician, what can we do to get that word out?
You know, we can do it one at a time, obviously, when we're seeing families in the office. We can certainly do through public health announcements, you know, trying to teach, you know, in whatever way we can to get through newsletters, newspaper articles. Hopefully there'll be more press with this, basically.
The interesting thing to me is that by age 8, our teeth are fully formed. So if we're being overexposed to fluoride, I'm not going to end up with fluorosis. But that doesn't mean that I haven't been exposed to too much fluoride, right?
Yes, and I think that's one of the tricks is that with fluorosis, it provides
it's visual cue.
You get the teeth. They're one of the few internal organs that we can visually see. And you know, there was a British scientist, Jennifer Luke, in the 1990s. She looked at the pineal gland, which is a small gland between the two hemispheres of the brain. And she looked to see if fluoride was accumulating in the pineal gland because it's a calcifying tissue and it takes in a lot of blood. And she found that the pineal gland is accumulating a lot of fluoride. It's accumulating more fluoride by concentration than any other tissue in the body. And the pineal gland is it regulates melatonin and important hormones. And what Dr. Luke said is,
sleep disorders, for example, could be
that's one of the implications
overexposure of fluoride
on the pineal gland. But what Dr. Luke said is can you be causing damage to one calcified tissue in the body, the teeth, because that's what fluorosis is. Fluorosis is fluoride interfering with the tooth-forming cells in a calcified tissue. Can you be doing that without simultaneously be causing harm in other calcified tissues, like the pineal gland or the bones? Now, there's really not been the adequate studies in the United States to really determine that, but I think it's something I think we really need to be doing the robust studies in the United States to make these determinations.
There's some question too about the impact that fluoride has on the absorption of lead.
Well, yes, there have been several studies that have found that children living in areas where hydrofluorosilicic acid is added to water have elevated levels of lead in their blood. Now, one study in 2006 kind of provided contradictory findings to that. So, but it's certainly a concern because lead is a very powerful neurotoxin. We know that lead reduces intelligence. So that is an issue that does. And there have been studies actually in 2007, scientists from the University of North Carolina in Asheville published a laboratory study which found that hydrofluorosilicic acid can leach lead from brass pipes. So that is a concern with fluoridation.
There was just, and I'm going to go to Jason, I'm sorry, and then I want to go back to another study from the University of North Carolina, a study that was sent to me by the Pennsylvania Dental Association, saying how effective water fluoridation is. And we'll follow up on that in just a moment. But Jason from Murraysville, you've been patiently hanging on. What's your question or comment, please?
I'm actually a dentist that treats predominantly Medicaid practices, Eastern PA, Northern PA, Erie region, excuse me. But I would have to say that predominantly the problem is not fluorosis. The problem is rampant dental decay. And you know, the minor amount of patients that we would see with fluorosis greatly outweighs the patients that we would see with just rampant decay who need multiple extractions, dentures at early ages. It's actually really, it's humbling at times because you see children who are 15, 16, 17 years old and you know, they're in a prosthesis.
And are these children getting fluoridated water?
To be honest with you, I'm not sure because the patients that we see are from 200-300 mile radius. So as far as you know, having fluoride in the water, I don't know. But the patients that I see with truly fluoridated water and the patients that I see who get routine 6-month treatments with topical fluoride don't show this significant amount of dental decay.
Okay.
First of all, I think it's great that this dentist
is providing
care to Medicaid patients, which is so important today, because studies have found that up to 80% of dentists do not accept Medicaid patients because the reimbursement rates aren't so great. And so that's, to me, that is the real, like, if we really want to help low-income communities, because that is where tooth decay is concentrated, we need to be providing real dental care. And I think industrial fluoride chemicals in the water, fluoridation, it's a nice notion that you can just deal with a complicated, difficult social problem by adding a little pixie dust to the water. But what you need dentists that populations can afford to go to. And one way to do that is to allow dental therapists, which are dental hygienists, but they act independently from a dental office.
With additional training.
With additional training.
They can work with underserved populations.
And I think that's really what we need to be doing to make, because if you look at urban areas, they've been fluoridated for 30 to 50 years, and they're still seeing oral health crises. They're still seeing severe baby bottle tooth decay and rampant cavities. So fluoridation is not preventing these disastrous effects that we should be paying attention to.
Most of Pittsburgh, by the way, is fluoridated. There are only a couple of pockets. I looked online, Shaler and Harmer, and a couple of holdouts in Pittsburgh that have said, no, we don't want water fluoridation. But the vast majority of what we would call Pittsburgh is fluoridated.
Yeah.
I was just going to say, I agree. I think the social equity issue is very important. And I think that has been one of the reasons why fluoridation in some ways has been as popular as it has been. It's been a cheap way to deal with the issue. Going to the dentist is much more expensive, and I suspect it always will be. But there are definite social equity issues here, I think, too.
Some, in the last couple of years, some 200 communities have stopped water fluoridation, and not for health reasons. They've done it for financial reasons. What's happened, Michael, in communities where they've said no more water fluoridation? Are we seeing an increase in cavities? Well,
the ADA, the American Dental Association, for 50 years has warned that that's exactly what would happen if you stopped adding fluoride to your water. But in the actual science, there's been 5 studies since 2000 that have looked at the tooth decay rates in communities that stopped adding fluoride to their water, and they found no increase in tooth decay. And in fact, they found that tooth decay continued to decrease. And so I think that it's a big question mark that you'd see any increase in tooth decay by stopping fluoridation today.
According to one article I read, Israelis and Palestinians will live in peace before opponents and supporters of water fluoridation agree on anything. And so I'll begin with you, Michael. Where do we go from here? And why, I'm sorry, but why do those who are opposed to it, why are they referred to? And I think both sides are well-meaning. I think the best of intentions from both sides. But, you know, those who oppose water fluoridation are regarded by many as crackpots and unscientific fearmongers.
Well, I would say 2 things. First, I think it's kind of silly to characterize the opposition to fluoridation that way. Now, of course, with any issue, you can pick any issue, and you're going to have the fringe kind of wacky side, and that's always there. But, you know, look at Dr. Arvid Carlsson from Sweden, and look at Western. I mean, if all of Western Europe is not a backwaters kind of place, they decided that fluoridation doesn't make sense. And also, call me a complete wild-eyed optimist, but I do believe that we can have a rational debate about fluoride in this country, and I think we can do it. I think we will do it. I think it's an issue that does have a lot of baggage. It's an issue that has a lot of preconceptions, and I think that if we can just put some of those behind us and kind of look at some of the basic facts that we've learned over the past 50 or 60 years, I do believe we can develop safer, wiser approaches to the use of fluoride. Now, but again, it's a heated issue, and I recognize that.
Mahal.
Historically, I agree. I mean, the vast majority of scientists and dentists have always been pro-fluoridation, but there have always been some very good scientists who have been anti, but I would still
and
say
dentists.
Yes, but I would still say the majority is still solidly with fluoridation. But historically, there have been some crackpots associated with it. I mean, in the early post-World War II period, some people considered fluoridation a communist plot. Now, whether they felt that the fluoride would be the ones who would be pacifying the people, or whether fluoride was a gateway drug to something else that you could use as some kind of mental medicine, I really don't know. But there has always been that fringe.
Well, the interesting thing is you look at the history of chemical use, and you know, one thing that's a best practice, you know, 20 years ago, we now know, for instance, candy wrappers had arsenic in them at one time, and now we know. My guess is you have lots of examples like that.
I completely agree. People often think once a discovery is made, that's the end of it. Science doesn't stop. Science is ongoing. I mean, think about what would have happened if, you know, after Newton had put together his theory of gravitation, people had said, hooray, we have a theory of gravitation. We don't need to do anything anymore with this. If we hadn't, we wouldn't have had Einstein's general theory of relativity. We would not have GPS, which means I would not be here because I would be lost somewhere in Pennsylvania. I mean, this is in some ways a very silly example, but science never stands still, so it often re-examines things that have happened. New knowledge is developed. So in some sense, I think now is a good time perhaps to reassess fluoride. Is there too much in the water compared to all the other sources of fluoride that we're getting? All these kind of things are scientific questions. Whether we should fluoridate water or not is in many ways not actually a scientific question. It becomes a political question. It becomes a social equity question. All these other things get involved that science can't actually answer. And I would say in the past, scientists have made the mistake thinking that this was purely a scientific issue. So if the science says that fluoride reduces decay, well, then it's obvious it should be put in the water.
With just a couple seconds remaining, your take-home message, Dr. Collison.
My take-home message is fluoride is beneficial to the teeth, especially in a contact setting. And
so topically.
Topically is by far the most important thing. And fluoride in the water has been beneficial. Certainly, any way that we can do that safely is to benefit to our kids and their teeth.
All right. Thank you all so very much for being with us. Our guests, Michael Conant, Mahal Meyer, and Dr. Craig Collison. We hope that you will join us on Thursday, April 11th. We'll be talking about privatization. For all of us at WPSU, I'm Patty Satalia. Have a good night.
Support for Conversations Live comes from the members of WPSU and from the Penn State Alumni Association, informing, involving, and inspiring Penn State alumni and friends worldwide through programs, events, and communications.